Well, today we convened an emergency meeting of the Health Committee here in the Assembly, and it's very apparent that there's real serious pressures within the health service. We have many constraints and many issues and concerns around potential delivery of health and potential cuts in the system. And I suppose there's pressures across many departments, but there are particular pressures within health. So we convened that meeting today because whilst we believe that there are pressures, we also believe that there's real questions that the Minister in particular has to answer to in relation to the mismanagement, in our view, of his budget to date. And I suppose when people reflect on the delivery of health, they see issues like £34 million being paid to senior consultants and bonuses. They see issues like almost £60 million every year going to the private sector, and we see real horror stories in relation to how our health service is delivered. So in our view, the Minister was before us today to answer those hard questions in relation to the mismanagement of his budget, which is not something that ourselves only are saying. His own party colleague, the Finance Minister, has pointed up on 2 occasions that he's expressed concerns around the management of the health budget. So clearly there are questions to be answered in relation to the delivery of health service.
Mickey Brady, what's your view of today's meeting?
During the meeting today, several times the Minister alluded to welfare cuts and blamed Sinn Féin's opposition to those cuts as one of the reasons his budget is in disarray, which is absolute nonsense. I pointed out to him in terms of health and how people's health would be affected, that because of the shambles created by so-called welfare reform in Britain, that the numbers of people being admitted to hospital with malnutrition has more than doubled. The number of people using food banks has gone up tenfold. And this is all about hunger. This is about people not being able to afford to feed themselves. So it really bears out what Sinn Féin have been saying in terms of the opposition to the welfare cuts. I also asked the Minister at the end, did he think that the cuts, the proposed welfare cuts, would have a detrimental effect on the health of the most vulnerable in our society. He agreed that it would, but was still prepared to go ahead and support cuts which can only have a detrimental effect on the most vulnerable in our society.
And finally, Maeve, what do you think were the main points to emerge from today's meeting?
Well, clearly we have a piece of work to do, and Sinn Féin won't be behind the door in doing that piece of work and ensuring that we address the current gaps that exist within health, and we'll attempt to find solutions to all of that. But clearly the Minister has to agree to our proposal around oversight and monitoring. There needs to be more oversight and monitoring and management of his budget process than there has been to date. We need to be assured that the processes are correct, that are in place, that are accountable, that are delivering for all of the people of all of our communities.